Hi everybody, Dr. Bulow here, and this whole week I've been talking about APGAR scores. If you've ever had a child yourself or you've known someone that's had a newborn baby, you might know that in the delivery room they rate the health of the baby based on, among other things, an APGAR score. The APGAR score is a way for a physician to look and see how healthy and lively a baby is. So for example, what the skin color is, if it's breathing alright, if the heart is beating. So when a newborn baby comes out of the mother's womb, the physicians take that baby, set it down, and listen to the heart, they listen to the lungs, they feel the hips, the muscles in the legs. But there's a piece missing. The one thing physicians do not do is they do not look at the neck of the child, the point where the brain and the skull attach to the bones of the neck and the spine. And in most cases, in regular birth, you can almost get away with that. But think for a moment the type of pressure that's on a child's spine if they are pulled out of the birth canal. Cesarean sections, forceps deliveries, even the physician's hands. When the baby is pulled out of the birth canal, it is an unnatural process. And what can very often happen is they can misalign the bones of the spine right around the spinal cord. So you would think that might be something to know about when a baby is born. Let me put it to you this way. Going back to our APGAR score. Our APGAR score looks at our heart. Why would we look at the baby's heart? Is it because the baby, the newborn baby, is grabbing a hold of his arm saying, "Doc, I'm having a heart attack, I've got chest pain"? Of course not. We check the heart because the heart's a very vital, important organ. And then the physician listens to the newborn baby's lungs to make sure it's breathing. Not because the baby is reaching for its inhaler, telling the physician, "I'm having an asthma attack." Not at all. But because the lungs are pretty darn important. Well, shouldn't we then look at the integrity of the bones that protect the spinal cord, which, by the way, control the heart and control the lungs? I would suggest so. It never ceases to amaze me. Every now and again I still come in contact with people that look at me and say, "You mean you do chiropractic with children?" And I almost want to reverse the question and say, "Do you mean you give medication to children?" I mean, it's the same body. We've got the same parts, they're just smaller. And how much more important to make sure and ensure a healthy spine and nervous system earlier on in life than wait till it deteriorates down when it costs a whole lot more money to fix. It decreases the quality of life in the process and is just a lot harder overall. So can I encourage you, if you've had a newborn baby recently or had a child recently, or have had any children that have never been checked upper cervically, or if you know someone whose birth process of their child was very rough, cord around the neck, cesarean, forceps, or they have a child that just isn't sleeping through the night, colic, ear infections, bedwetting, can I suggest to you that perhaps, even though the APGAR score said that that child was alive, perhaps that child was never functioning perfectly from the beginning. Because this was never checked. Something to think about, a different way to look at the health and wellness and the evaluation of newborns in the upper cervical health centers here. We do it all the time. So if we can help or be of service, please do not hesitate to contact us. We always offer free consultation and evaluation for anyone in the community to see if this is right for them. If it's not, we'll let them know, but if it is, we'll let them know that too. Take care. We'll talk to you next time.